Good afternoon, everybody. Thank you again for joining us for our regular Ageless Talks. I'm very happy to be here again today with one of my team members, Connie, who is going to speak about how weight and longevity go together. And so, this is an issue that is, to me, very interesting and very related because, especially here in North America, we battle with weight issues. And that directly impacts our quality of life and our length of life. And so there's many studies that have shown that. And so we're hoping to be able to touch on some of the importance of that and how that plays a role in our overall well-being. And so I am going to be the host mostly today. I'm not going to be mostly the presenter, although I will speak on this podcast. And so I am Jean-Paul Lim. I am a medical doctor. I am a longevity specialist, but I also, for the last 14 years, have been an internal medicine specialist focusing on complex care, cardiology, ICU. And so my passion is in this and exploring kind of a holistic way to approach wellness and healthcare in general. I'm an instructor at UBC. If you've seen any of the other podcasts, my credentials haven't really changed. I'm still who I am. And so I would like to introduce our main speaker today, who is part of our Ageless team. Her name is Constanza Moraga. She is a medical doctor from Chile. And so she is here now in the Lower Mainland. She is a certified holistic nutritionist, a lifestyle medicine practitioner, and she's a gut health expert. And so she's got a big passion for nutrition and gut health. I'm so fortunate. I honestly do feel very fortunate that she's part of our team and someone that I rely on a lot for our weight program and our longevity program. And so I'm very pleased to have her present, and I'll add some things as well. So here we go.
Well, thank you so much for the introduction. I'm very pleased to be with all of you as well. So let's start by another one. So let's start by defining some key concepts that I think we all have to be familiarized with. So we all heard about overweight, obesity, and abdominal obesity, right? But what do they really mean? And what do they have in common? So they all have one thing in common, which is an excess of body fat, which can significantly affect our health. So let's begin with some definitions. Overweight is typically defined by the body mass index between 25 and 29.9. BMI is a measurement that compares your weight to your height. And then obesity, on the other hand, it's also defined by a BMI, but 30 or higher. Now, while BMI is a common way to assess body fat, it's not the only method. And we will look at other more accurate ways of measure this later on. So we have this really important concept here, abdominal obesity. And this is a really important term to understand, and it's actually a more accurate way of evaluating this excess body fat, because this is closely linked, or it can also be known as visceral fat, which is the fat that surrounds our internal organs. And abdominal obesity is defined by a waist-to-hip ratio more than 0.9 for men and 0.85 for women. And this is something really important. This type of fat is metabolically active and inflammatory. And another important thing to note is that fat is actually an endocrine tissue, which means it produces hormones that can influence our health and metabolism. So too much of this visceral fat can actually increase the risk of cardiometabolic diseases, even if you're not overweight or obese. And that's really the key, right? So when we talk about weight, it's not just about the number we see on the scale. Fat distribution is just as important when it comes to our health.
Yeah, I'm so glad that you said that, Connie, because we tend to think of fat as just a part of our body, not realizing the negative consequences. Of course, fat is good. It's the most efficient way to store energy. That's why we make fats, right? But if you have too much of it, it becomes
A problem.
That's right. It's inflammatory, and it is, and that's how it affects your life. And it's hormonally active. And I'm glad that you said that because we're going to touch on these things. And I'll probably touch on it a little bit later on. But I've had many conversations about the GLP-1 agonist, which we're going to talk about eventually, and its effect on inflammation, because it's said, like you see it on TikTok, on social media in general, how Ozempic and GLP-1 agonists have anti-inflammatory properties. But I don't know whether it's independent of its fat-losing properties, right? And so if you get rid of a whole bunch of fat in any way, you're going to reduce inflammation. So that's a very interesting point that you make.
So now let's dive deeper into how this excess of body fat can affect our health. In the last podcast, Dr. Lim talked about the 4 horsemen, which are the 4 most common diseases that can impact our health nowadays, which you can see here on this chart as well. And these are some of the most common diseases we see in people with excess fat too. So let's talk about numbers. On this chart, the light blue represents the risk associated with being overweight, and the darker blue represents the risk linked to obesity. So when we look at the risk for type 2 diabetes, being overweight increases your risk by 20%. But if you're obese, that risk goes up to 50%. That is huge. Then for cardiovascular disease, being overweight increases your risk by 22%, while if you're obese, this is up to 65%. This is specifically when it comes to stroke risk. And then when it comes to cancer, at least 80% of all cancers are directly attributed to obesity.
Wow.
In fact, there are certain cancers that are more frequent in individuals with obesity. So we have those ones here as well. So postmenopausal breast cancer, colorectal cancer, endometrial cancer, pancreatic cancer, and prostate cancer. And another area of big concern is neurological disease. And dementia has been linked to a 24% higher risk in people who are overweight and up to 34% in those who are obese. And these are just a few of the many diseases linked to obesity. We also see higher rates of joint problems, especially knee and hip arthritis, and then we can also see depression. So as you can see, addressing weight and excess fat is critical when it comes to our quality of life. Because even a modest reduction in weight, just 5 to 10% of your total body weight, can have significant improvements in your metabolic health. So we can measure that actually. And we can see a reduction in hemoglobin A1C, up to 1%, which is huge, almost the same as metformin does.
Very interesting. Now, I just want to ask you, Connie. So when you look at this chart, because of how it relates to the 4 horsemen, right, you've got a higher risk if you are overweight and obese. And I assume that means if you get rid of your obesity or overweightness, if that's a word, that you will reduce your risk.
Yeah. So they have some causal effect in these conditions. So we actually have studies where we have seen if you reduce your weight, even 5 to 10%, we can actually see lower rates of dementia, cancer, cardiovascular disease, and type 2 diabetes.
Interesting. Can you talk about whether that risk is independent to diet? Because, like, for instance, I just see here, like, colorectal cancer, red meat has been linked to, or excessive red meat intake has been linked to colorectal cancer. So I assume that nutrition and what you choose to eat, independent of your body fat composition, also affects these risks, yes?
Yeah, it also plays a huge role, especially when it comes to colorectal cancer, because of the red meat that you mentioned. Yeah. So the whole idea is to have more fiber intake through fruits, vegetables, and then more plant-based protein and plant-based sources of protein. So that's the whole idea. So because of the anti-inflammatory component that they have.
So I think this is an interesting conversation because I think it highlights the importance of not just weight loss independent of everything else, but weight loss in conjunction with a proper diet. Like, for instance,
a lifestyle.
Absolutely. Because, for instance, I'm sure we've all heard of the carnivore diet.
Yeah.
Right? And I have people that swear by losing weight using a carnivore diet.
And you can lose it, but it's not healthy.
That's right. And so and people have found that out with the Atkins diet. I don't know if you remember when Atkins diet was a big fad.
Yeah.
People people would lose weight and they would develop heart disease. And it was
Exactly.
like, well, you reduce this risk, right, with getting rid of the fat, but you traded it for something else.
Yes, exactly. And
Right?
then you can also see higher cholesterol levels and higher risk of heart attack. So, yeah.
So I think it's important for us to let everybody know that weight loss shouldn't be the main driver.
Yes,
Right?
absolutely.
So, you shouldn't go. I'm going to give a bad example. Back in the 80s, there was this fad diet called like a fen-phen diet, where essentially you were using a whole bunch of stimulants to lose weight, right? But because weight was the ultimate goal rather than health,
Exactly.
right? So I'm glad that you brought that up. Thank you.
Okay, so when we think of what's causing all of this, there's no simple answer, right? There are actually multiple factors at play, which is why it's so important to take a holistic, integrative approach. So let's dive into some of the main contributors. Let's start with epigenetics. This is how our genes respond to our environment and lifestyle choices. So while we may have a genetic predisposition to be overweight or obese, the way our genes express themselves can be influenced by the decisions we make every day. How much we move, how much we eat, our sleep patterns, and how we manage stress. So actually, and the good news is, genes are not destiny.
Love it.
Then the environment around us has a huge impact on our health as well. And by environment, I mean things like our society, the cultural norms we live by, and the food system. Right now, we are living in a world where processed foods loaded with fats, sugar, and additives are everywhere, super easy to grab, and sometimes they can even be cheaper than healthier options. But it's not just food. We also have our activity levels to have in mind, our sleep patterns and stress, because they also play a big role. And of course, we have medical conditions, right? And then, so your past medical history is really important because certain health conditions can make it easier to gain weight or harder to lose it. Take hypothyroidism, for example, a common endocrine imbalance that slows down your metabolism, which can lead to weight gain. We have other hormonal imbalance as well, like PCOS, polycystic ovary syndrome, or insulin resistance. They all play a role. And we also have medication that can alterate with that as well. And then we have neurobehavioral factors. And this is really interesting because obesity is just much more than food and exercise, right? So it's also tied to how our brain works and how we behave. So when it comes to neurological factors, our brain plays a huge role in how we feel hunger, fullness, and cravings. And sometimes our brain circuits can make us overeat or crave unhealthy foods, especially if we don't get enough sleep. So hormones like ghrelin, which is the hunger hormone, and leptin, the fullness hormone, can get out of balance, leading us to eat more. And then emotions play a big role. Stress, anxiety, or even just boredom can lead to emotional eating, using food to cope. Mm-hmm. So emotions are often behind our food choices. This is why it's so important to take our mental health and cortisol control into consideration. And then here's something really interesting that I think we'll both love, right? So microbiome dysbiosis. Well, microbiome refers to all the microorganisms that we have in our gut, right? I will dive deeper into this later on, but when the balance of these microbes gets out of whack, it's called dysbiosis. And it's been linked to obesity and other metabolic disorders as well. And this balance can be influenced by our diet mostly, but it can also be influenced by some gastrointestinal disease. So a healthy gut microbiome is essential because it can help us regulate hunger hormones, also supports digestion, and even influence how we store fat. This is why this is another area of interest for us, which is often overlooked, right? And all of this is key to finding what works best for each person. That's why looking at all of these factors is the best way to manage weight and improve health. And that's exactly what we do.
Yeah, I love your approach and your knowledge. I mean, I have to say that I don't usually see people talk about weight this comprehensively and have this many factors. You know, most people talk about weight, when someone's overweight, they think like you
Food,
eat too much,
exercise,
right? Or
nothing
you
else.
sit there, you sit around. And admittedly, in our society, that plays a role, right? With all the fast food and how easily food can be come by.
Uh-huh.
But what you have really identified here is that that's not the only reason. You can't just assume that because someone is overweight or obese that it's because they eat too much or they're lazy,
Exactly.
right? There is lots of other potential causes.
Lots. So, is there anything we can do to take action? Of course, plenty of things. So, first, we can start by identifying and assessing the risk. And we use different screening tools to do that. So, BMI, that we talked before, right? And then we have waist circumference or waist to hip ratio to help us understand where the fat is being stored. Then we also dive into medical history, looking for thyroid imbalance or PCOS, as we talked before. We look at lifestyle factor, because if someone smokes, doesn't exercise, or has poor sleep habits, they are at much higher risk for obesity. Then we look at weight story, genetics, epigenetics, and we can also check for blood work. We can look for hormone levels, cholesterol, insulin-resistant markers, or metabolic markers like hemoglobin A1C. And now, for a more detailed look, we also have the DEXA scan. This is an imaging test that measures body fat percentage, muscle mass, and bone density. And it's really cool because it can give us a much clearer picture of someone's body composition than BMI alone. And all of this can give us a clear idea of potential risk, allowing us to prevent early in the first place. The idea is to stop obesity from developing, or at least prevent some serious consequences like the fourth horseman. But if we are already dealing with excess body fat, we also have the treatment portion of our approach. And when it comes to treatment, we always start with lifestyle changes. So starting with nutrition, we use epigenetic guided nutrition. This means we take each person's genetics into account, tailoring their diet to their specific needs. But that said, one of the most effective strategies is a whole foods plant-based diet, which essentially means including more fiber through our diet, right? Fruits, vegetables, nuts, seeds, legumes, and whole grains. That's the whole idea. And at the same time, we minimize animal products and cut down processed foods. That's essentially what our main focus is. And then another critical aspect is exercise. Exercise can help boost our metabolism, increase basal metabolic rate, and optimize fat burning. And then managing stress, as I said before, is just as important as managing food. That's why we use biohacking techniques to help control cortisol, which is our stress hormone. And we use advanced tools like No Calm or Brain Trap, which can help mimic meditation. And this is really cool. Then we also evaluate and treat any hormonal imbalance that may have. And then when there is a need for little extra help, we can use IV vitamins and supplements. So we can use, for example, B vitamins, omega-3, functional mushroom, or adaptogens. It all depends on the person's unique case. Gut support also plays a big role, and we have an entire program dedicated to that. Then when it comes to extra support, in some cases, medication might be needed to help manage weight. That's when we use GLP-1 agonists such as Ozempic, Mounjaro, and Wegovy. They help regulate appetite, but also blood sugar. And we will discuss this in more detail later. And probiotics also play a key role in gut health. We have some specific bacterial strains that I will talk later on. And now, another key area is monitoring. So we track BMI, waist circumference, blood work, blood pressure, or DEXA scan, so we can adjust the treatment plan if needed to ensure the best possible outcome. So to wrap it up, it's all about identifying risk early, preventing problems from getting worse, treating and making ongoing adjustment to find the best possible outcome.
Yeah, and I guess for the supplement part, we also have to be aware that with weight loss, that there are going to be some, especially depending on how fast you lose weight, right? Like there's going to be some nutrients that you're going to have to replace. But oftentimes we should be able to get that with diet, though, right? With a proper diet, and so
most of the time, unless there is a huge microbiome dysbiosis.
That's right. Okay, so again, very, very interesting that things really have to be looked at more holistically, where you shouldn't just go diet and lose weight.
I think you and I have talked about this many times. Anybody can lose weight when you eat 800 calories a day.
Oh, yeah.
But you're not really getting to the root cause of the problem, are you?
And you end up gaining all the weight back.
Yeah, because who can eat 800 calories a day?
Yeah.
Very interesting.
And this is another really interesting concept for all of you to understand, which is GLP-1 and the microbiome. So GLP-1 stands for glucagon-like peptide 1. This is a naturally occurring hormone that plays a critical role in regulating appetite, blood sugar, fat storage, and digestion. And GLP-1 is produced in the intestine and acts on several organs, including our pancreas, GI tract, brain, liver, and heart. It helps regulate our appetite by increasing satiety or feeling full, improving insulin sensitivity, and supporting overall metabolic function. And it's because of all of this effect that GLP-1 is crucial for weight loss and metabolic health. And what does the microbiome have to do with all of this? Well, we briefly mentioned this earlier, but our microbiome refers to the trillions of microorganisms that we have in our gut. So this includes bacteria, fungi, parasites, archaea, and other microbes. And they play key roles in our health. They influence our body weight through energy metabolism, low-grade inflammation, and this is key, and alter gut permeability, often referred to as leaky gut. So addressing our microbiome is crucial, and it's a key part of our treatment. And this is a crucial connection. A healthy gut microbiome produces short-chain fatty acids like propionate, butyrate, and acetate that stimulate the natural release of GLP-1. This means that a healthy balance of gut bacteria will naturally produce GLP-1, right? Unfortunately, many people today are dealing with microbiome dysbiosis, meaning there is an imbalance between the good and the bad bacteria or other microbes, which will interfere with the natural production of GLP-1. So one of our many tools is using probiotics with specific bacterial strains that have been shown to boost GLP-1 levels. And this includes Akkermansia mucinifila, Bifidobacterius infantis, lactis, and Clostridium butyricum.
So can you just comment to our viewers, how does, we talk a lot about gut dysbiosis, right? How does someone even get gut dysbiosis, and why, and is it common, and is it something that, so how do people get it? Is it common, and who should be concerned about it?
It's extremely common. I'd say the main factor is through diet, the main factor, because we don't get enough fiber from our diet. We should be eating between 30 to 40 grams of fiber per day. So we actually eat this fiber, which we also known as prebiotics, and these are the one that feeds the good bacteria. But if we end up eating processed foods or junk food or unhealthy foods or just protein and fat, that wouldn't be any good for our microbiome. So we end up feeding the bad bacteria instead of the good ones.
So for someone like me that doesn't actually know what 30 or 40 grams of fiber means, what does that mean?
So at least between 3 or 5 different fruits and vegetables per day, legumes every day. And this is really difficult.
And that when you say 3 to 5, is
servings.
that servings?
Yes, servings.
And again, for someone like me that doesn't really know this, what is a serving of vegetable?
So we usually measure starchy vegetables like potato or turnip. So it's around 1 cup most of the time. But any other vegetable, you don't even need to measure. You just have to. Variety is key. So
3
you
to
have
5.
and then
That's a lot.
it's a lot. And
When
then
I just think of my diet, that's a lot. Okay.
And then in 1 week, you should aim for having at least 30 plants in 1 week. Plants like fiber, fruits, vegetables, legumes, seeds,
30
spices.
servings of plants or 30 different plants?
30 different plants.
Whoa.
It's tough.
That's tough. Okay. Wow.
Yeah.
And then how do people, so fiber. I have heard also that antibiotic use and antibiotic abuse is also a culprit of gut dysbiosis.
Yes.
And certainly I know in my non-longevity practice, we use antibiotics a lot.
Yes. And that can also really mess up our gut, especially because we end up killing the good and the bad bacteria.
And then
that's the whole problem.
the bad are usually stronger, so they can
Usually
grow
stronger.
faster than the
Exactly.
good guys.
Yes.
One interesting thing that I remember learning about the importance of the gut microbiome and why this has become so fascinating to me is that obviously this is an experimental point, a fact I'm going to make. Maybe it's not a fact, experimental theory, but if you were to disintegrate a human being into its DNA, we would actually find more bacterial DNA than we would of
Oh,
human
yeah.
DNA.
That is
And
true.
and the reason that I find that very interesting is because not that we're actually more bacteria, because we're obviously a human, but it just goes to show the importance of this symbiotic relationship that we really need to
Exactly.
pay attention to, right? Where we should pay attention to the gut. And I don't know if you agree, but I've read and have been taught that some of our cravings, some of it may be hormonal, but a lot of it could be from gut dysbiosis as well, where we have
100%.
cravings of sugar
100%.
or, because the gut, as we talked about with fat, the gut is also like the gut microbiome is also very hormonally active.
Yeah,
Right.
it
So
is.
I often tell patients, like, is there a time where you eat certain food and you just feel bad? Right? Or you feel more sad, or you feel something, or maybe you feel happy, and that's hormonally mediated, and the gut microbiome is involved in that. Do you agree?
Yeah, of course, 100%.
Yeah.
And then there is actually a condition called a SIFO, when we have like an overgrowth of fungi. So that's actually more fungi in our intestine, and they ask for sugar
Yeah.
and sugar addiction and sugar craving. So that's something important to consider.
Yeah. And I just want to quickly touch on the GLP-1. GLP-1 to me is like, it really has changed the landscape to how we approach obesity. And I don't know if actually your next slide is GLP-1, is it?
Yes.
Okay. I'm going to
is.
leave it then. Let's go to you.
Okay, so as you have seen, one of our main focuses when it comes to weight management is boosting GLP-1 levels. And we can boost GLP-1 naturally or, if needed, with help from medication. So let's start with the natural approach, through lifestyle. So with nutrition, we really focus on supporting the microbiome. And for that, we focus on prebiotics. Prebiotics are fibers that feed the good bacteria in our gut, and then when these bacteria digest them, they produce metabolites like these short-chain fatty acids that will boost our GLP-1 levels. Some examples include garlic, onions, asparagus, and bananas. They are really high in fiber. And then we have something really interesting, spices. Because 3 spices have been shown in human studies to boost GLP-1 levels. These include turmeric, cayenne pepper, and cinnamon. Just 1 teaspoon a day can really help you boost your GLP-1 levels. And then for supplements, we can use, for example, omega-3 fatty acids that help you reduce inflammation. And then we can also focus on fermented foods like kimchi, sauerkraut, kefir that can help keep the microbiome healthy. And probiotics, specifically these strains that we talked before, like Hermansia, Bifidobacteriums, can support GLP-1 production too. Now let's talk about exercise. Regular physical activity has a direct effect on improving our basal metabolic rate, or BMR, our hormone balance, and metabolic health. We actually focus on a mix of strength training, aerobic exercise, or cardiovascular training, and sometimes high-intensity interval training as well. And then we have this extra help from medication, right? So for those who need extra help, there are medications that mimic the action of GLP-1, and they are known as GLP-1 agonists. This includes Ozempic, Mounjaro, and Wegovy, and they have been approved by the FDA for conditions like diabetes, obesity, and even for cardiovascular protection in people with obesity. But there are a couple of important things to note. These medications require monitoring and supervision by a physician because they can have some potential side effects, and they also have contraindication, just like any other medication, really. So as for side effects, the most common ones are gastrointestinal issues like nausea, diarrhea, and constipation. And you can also experience some cosmetic side effect if weight loss happens too quickly, especially without proper guidance. So you can have sagging skin or muscle loss. But this is really the key, guidance. So with the right support, we can prevent these side effects from happening in the first place. So just an example as to manage side effect, we can focus on nutrition strategies and cosmetic support if needed. So for example, treatments like microneedling or radiofrequency therapy, which we offer at our clinic, can really help improve skin health and elasticity. Another example for managing side effects is focusing on strength training and making sure you're getting an adequate protein intake to prevent muscle loss. But this is something really important as well, contraindication, which is why it's essential to work with a physician because not all medications are suitable for everyone. And a doctor can help determine if these are the right choice for you. But when used correctly, this medication can really help lower the risk of diabetes and heart disease and improve your quality of life. So they can literally be life-saving. So it's really important to weigh the benefits against any potential drawbacks or side effects.
I totally agree. Just a few things that I want to clarify to our viewers. I know this says boosting GLP-1, and it's absolutely right. GLP-1 agonists, I know that Connie didn't mean to imply that it boosts GLP-1.
Right.
The
Yes.
GLP-1 agonists, they essentially work as flooding your GLP-1 receptors with a molecule, you could say. It's actually a peptide that looks just like or similar to your GLP-1. To what
Exactly.
your body makes. And so it doesn't actually boost your intrinsic. It just gives you much higher doses. And I just want to quickly also back up here a bit and just talk about GLP-1. And it's important to understand where it acts and therefore what the benefits and side effects are, because it then becomes predictable. So there's really three main places that GLP-1 in your body normally acts at. The first is your pancreas, all right? It helps to secrete insulin so that it's in a glucose dependent manner. So as your sugars rise, it secretes insulin and it brings that down. And that's predominantly how it works in diabetes. The second is at the pancreas level also, and at the liver level, it reduces glucagon secretion so that it doesn't cause spikes in your sugar. The second place that it really acts on is your brain, in the satiety center in your brainstem. Okay, there's a small little part in your brain that controls excuse me, your feeling of fullness. Excuse me. And it acts on this part of the brain to tell your brain that, hey, I'm full, I'm not hungry anymore. But another way that it controls satiety or feeling full or not hungry is how it acts directly on the intestine. And so it reduces intestinal motility, which means the intestines don't move as fast, and it reduces gastric emptying so that the stuff that you eat stays in your stomach and the stomach stretches and you feel fuller or full faster. The reason that that's important is that you can then predict its side effects, right? So if you flood yourself or all of your GLP-1 receptors with too much Ozempic or too much GLP-1 agonist, then one of the most common side effects is that you get nausea, vomiting, and constipation, right? And the reason for that is because you have so many GLP-1 receptors in your intestine and it slows down. And so you can get this huge, slow motility of your intestine, and that sort of backs up. And that's why people feel a bit nauseous, right?
Yes.
And so I think it's important to understand how it works, because when you're looking at a plan, right, like when someone comes off of it, those GLP-1 receptors are not going to have any more GLP-1 on it, right? And so especially if you're on it for a long term and you're not trying to boost your internal, is that the body's natural GLP-1 secretion will be decreased because you gave it, let's say your body needs 3 units and you've given it 50 units. And so it's like, well, I'm not going to make 3 units anymore. I'm going to make 0 units. And so when people come off the Ozempic or these GLP-1 agonists, is that all of the receptors, they stop having any GLP-1 binding it, right? So the key is you got to make sure. And so guess what happens? all of those things are going to go away, right? The satiety, the fullness, all the side effects as well. And so all that goes away, and then that's when you just gain all the weight back.
Yeah, if you don't have like this enough like guidance through the process, and if you don't make any changes that is sustainable for you over time, 100%.
Yeah.
So what have we learned so far? GLP-1 is a critical hormone for weight loss, insulin sensitivity, and longevity. A healthy gut microbiome supports GLP-1 production and overall metabolic health. Diet, exercise, gut health, and medication, they can all support GLP-1. And we also have hormone optimization, which is a critical part in the process. It improves basal metabolic rate and fat burning, while cortisol control reduces stress and supports our metabolic function. And lifestyle medicine brings everything together for sustainable weight loss. And here the focus is on addressing the root cause so we can have a successful treatment.
Yeah, and I think we've talked about this, right? GLP-1, great. It's certainly revolutionized. It changed the landscape of weight loss. But it's not everything. GLP-1 isn't the only thing that someone needs to focus on, right? I think that's what you're saying.
Yes.
Is that, listen, okay, GLP-1's great, but what about the other stuff?
Yeah, our lifestyle plays a huge role.
Yeah, and the hormones, we talk about it, right? Like basal metabolic rate, that's going to be impacted by, hormone optimization, by exercise, by what you eat, all of that stuff. And so, very good sort of overview.
So this is Ageless Living's approach. If we divide our approach by system, we take a holistic and science-based method that focuses on optimizing these 5 key areas that we have been discussing, right? So we have GLP-1 optimization as one of them. Then we have hormone balancing. Then we have controlling cortisol control levels and mental health support, which is really important. And then when it comes to nutrition, we focus on in a concept that we call smart caloric intake, right? When we focus on nutrient-dense foods that are low in calorie, like fruits, vegetables, and legumes, right? And then exercise to keep a good balance between these two. And final, but of course not least important, our gut health optimization, which we have seen plays a critical role in our health and metabolism. We aim to naturally boost our GLP-1, reduce cravings and inflammation. And all of these systems are interconnected. This is why addressing all these key areas, we work to create a well-rounded approach to health.
And I love that you said that at the end, actually. It's not here on the slide, but it's, the body is interconnected. I mean, I think if you ask most people would understand that. And yet that's not the way that medicine is practiced now, is it? And so, I just think of my own practice. I mean, we always, I was thinking about this morning as we were preparing for this podcast, and I was like, the way that medicine has evolved, it really has tried to parse people apart.
Yes.
Right? It's like, okay, well, let's look at the endocrine system. Let's look at the cardiovascular system. Let's look at neurologic system. And then you realize actually that they're all related, aren't they?
Yes, they're all connected.
Right? And so one thing that you do will affect another. And it's very interesting because when I think about medications, right, and I think about how they're developed, and I'll probably make a different podcast for this, but generally, that's why medications, pharmaceutical medications, have such unusual side effects. Okay? Because there's nothing physiologic about the way they were developed.
Yeah. It's
right?
like a Band-Aid.
Yeah, and it's very interesting to me because you have these side effects. You're like, that's such a weird side effect. Like, how did we even get that? And it's because you did something to the body that it was never meant
intended
to do. Like, you're never meant to just trigger one receptor because the body doesn't work that way. It triggers a whole bunch of different receptors and sometimes turns them on, sometimes turns them off, sometimes partially turns them on. And then in it, there's a cascade of other processes that happen. And so it's good that you have mentioned that weight loss and weight control has to be approached in really the same way, right? Where we have to look at someone holistically. And that's what I think a lot of people, myself included, are frustrated with the other sort of weight programs out there that just focus on follow my meal plan or, follow this kind of meal or order my meal plan for $300 a month.
And it's usually a shake. So.
Yeah, and it's usually like 800 calories a day, and you can just go eat 800 calories a day regardless and lose the same weight. And so I think that the approach that you have outlined really is quite different, and certainly something that I, over my years of practice, have really come to realize that the body really is in a symbiotic relationship with not just our own cells, but our bacteria and actually our environment, which we talked about as well, right?
Yes. So what can you do? Well, first, you're already doing one of the most important things, which is raising awareness and recognizing the risk. Early identification and detection are key to achieving the best possible outcomes. The sooner you address potential issues, the more effective the intervention can be. Next, make sure you take a holistic approach where everything is taken into account. Your nutrition, your lifestyle, your stress management, hormones, and gut health. It's all connected. And finally, be prepared to take active control of your health. And this is crucial as well. We provide you with a variety of tools, but you are the one who must take the ultimate action. Your health is in your hands, and we help you take your health back.
Thank you. I mean, one of the things I want to touch on, point number 3 here, which is Ageless's approach to, multidisciplinary, team-based approach. It's really the way that I see healthcare should be delivered in general. Certainly in North America, it's not the way healthcare is delivered. But one of the things that we haven't really even touched on, and I was going to get another team member to join us to talk about the skin effects or aesthetic effects of weight loss, including with Wegovy or with Ozempic, that you need to recognize. Because one of the things that we've talked about already, and I talk about all the time in my other podcasts, is prevention is much better than reaction, right? And so if you can recognize that people are going to develop skin problems, right, from weight loss or from the medication, then to address them earlier is better than addressing them afterward.
Absolutely.
So we've all gone on Instagram and TikTok and have seen this phenomenon called Ozempic face.
Yeah.
Right? And again, I'm probably going to have a separate podcast on this because we're already over time here. Ozempic face isn't necessarily specific to Ozempic.
No, it's not.
Right? It is
The
general
rapid
weight loss. It's just rapid, profound weight loss that causes these things. And it's gone through social media to say, like, this is something that we need to be aware of. Yes, but the goal is don't get to the Ozempic face.
Yeah.
Right? With Ageless Living, because everything is in-house and because we approach things in a team-based approach, you can get the kind of recognition that things may happen and get prophylactic or preventative sort of treatment, right? So for instance, microneedling to help skin tighten and boost collagen production in the face as you start losing the fat, right? So these are really important things. Again, I'm probably going to have a separate podcast because it's a big topic in and of itself. And clearly looking at the time, it wouldn't have fit today.
Okay, so these are just some of the ways that Ageless Living can help you. So we have this hormone balancing program, biohacking techniques to help support our mental health weight program, skin rejuvenation that Dr. Lim was just talking now. And these are just some of the tests that we can do at our clinic, right? Would you like to explain some of the tests, or are we kind of...
Oh, we're probably going to have to skip this just because there are so many questions that I'd really like to be able to get to.
Okay, perfect.
So here's some of the general FAQs. And honestly, I think, maybe I'm just trying to think of, maybe we'll just quickly go through them because we've got a ton of questions that I want to be able to get through and we're running out of time. It's just such a big and interesting topic. So let's just talk about this. I'm going to ask the questions, Connie, and for you to just sort of just talk about how much does sleep affect weight?
Okay, sleep is huge when it comes to weight loss. If you don't get enough sleep or if you don't get proper sleep, we actually see an imbalance between our hunger hormone, which is ghrelin, and our satiety hormone, leptin. So they can get out of balance without proper sleep, leading us to crave more unhealthy foods and to eat more. And then if you don't get enough sleep, you can also raise your cortisol levels, and then having more cortisol can translate into having more inflammation, more fat being stored, and slow your metabolism.
So it can affect your ability to lose weight, but can it also make you gain weight?
Yes.
Yeah. Good.
Absolutely.
Yeah. In the same way.
Same
Yeah.
way.
Okay. This is a question that actually we asked in one of my other podcasts, I think the first one. How does menopause play a role in weight gain?
Okay.
Right.
This is a really good question, and it was really asked a lot for this podcast. And menopause can lead to weight gain mostly because of a hormonal imbalance between estrogen and progesterone levels, but that's not the only method, right? We also have to be looking at our sleep patterns because of what we just discussed. And then something that is kind of, like a consequence of menopause is losing muscle. And as we lose muscle is actually such an important organ. It's an endocrine organ which can also boost our basal metabolic rate and can help us burn calories. So that's also something important to have in mind. And then in menopause, we also see higher prevalence of sleep disruptions. So it's a mix, really, of different things.
I've also read that the changes in the hormones, the sex hormones in menopause, actually impact your gut microbiome.
Yes.
Yeah. So, sorry to my women viewers, it's multifactorial. It's a variety of things, and it sucks. I'm not going to lie. But one of the questions that we had that I might as well answer here is actually, how do you deal with the weight gain with menopause? And I think I'm going to answer this more because I have more experience with this. And Connie, you can jump in here. But in general, I would say when I first started practicing, I thought, okay, well, that's great. You gain all this weight. You go to my podcast in menopause. I say you gain an average of 1.5 pounds per year through your perimenopause and menopause phase. So you can gain, let's say it lasts for 10 years, you can gain 15 pounds easily. And I said, oh, well, that's great because if you balance their hormones, it just reverses. Not right. Rarely does that happen. So when I balance women's hormones, they feel great. All that their hormones are balanced, but the weight is very stubborn. And actually, I see that a lot with people who have gained weight for a variety of reasons. Be it from inactivity or from the COVID pandemic. Their physical activity should make them gain weight or lose weight, but they sort of plateau. And so what I would say, the answer to the question of, what do you do about postmenopausal weight gain is that prevention is the easiest. All right. So if you can balance your hormones before you gain that weight, way easier. When you've gotten to the point where you've already gained the weight, it's not impossible, of course. We can help, but it just requires more help. And that's where you may need things like a GLP-1 agonist, and we have to be more specific about your gut dysbiosis because, as we mentioned, you probably have developed gut dysbiosis going through menopause, and now you got to fix that problem. Mm-hmm. Right? So prevention is the best. If you can't, we can do it. It's just more work. Okay, the next question. How do you keep the weights off?
Okay, so here the key of our whole program is to find something that works for you. We don't use generic diets or generic recommendations, so we actually create a plan that you can sustain over time, and that's the key. So we usually find healthier swaps to the foods that you really, really like, for example, but we make it healthier. And the key is just that, like to find something that works for you so you can maintain over time.
Perfect. So I'm going to go into our questions, our more audience-related questions. But before that, I'm just going to put this slide up. So in order to help our interested viewers or your friends or family want to lose weight or help you lose weight in a holistic fashion, we are offering some promos for the month until the end of February. All of our services can be provided virtually. We can ship medications throughout North America. And so it's easy. People can come and see us virtually. And so the option, the first one is going to be, you can pay the fee, which is usually upfront. We recognize the economic times that we're in, so you can pay monthly and without any interest. Okay, but you are committed to the 6-month program. The other option is you can pay for the full amount and you get an extra month free. So instead of getting 6 months of weight loss service, you're going to get 7 months. Okay. Now, for those who are here live, text message this phone number here, the phone number to the bottom left-hand side of your screen for your chance to win a gift card. Okay, so I'm just going to leave this slide up, and the rest of it is just going to be us sort of chatting, because we had a lot of questions from our audience in terms of who registered, and so I'm going to go through some of those questions. But first, do we have any live questions?
Yeah. So we have one that says, does GLP-1 Ozempic guarantee weight loss?
Okay, so the question is, does GLP-1 agonists or medications guarantee weight loss?
I would say it guarantees weight loss as long as you are true to yourself. I mean, you are ready to make changes, and you're ready to make changes in your diet, your lifestyle, and all the things we have discussed. What would you say?
Yeah, so to me, I'm just basing this on my experience, and I would have to say that, first of all, in medicine, there's no guarantees, and I never guarantee anything. I think there's a good likelihood that you would. Now, I can say that there are some patients who don't respond to GLP-1 agonists by itself, okay? And I think those are patients who tend to not be on a holistic program.
Yes.
Right? And so essentially what, not to take so long to answer this question, but a GLP-1 agonist, essentially it floods your body with GLP-1-like molecules to saturate the receptors. And so, it gives you, say, 10 times or 100 times what your body normally makes. But if you've got poor receptors or poor receptor sensitivity, then it won't really matter. And so that's
Right.
why a lot of what you talked about, Connie, already, which is approaching this in a more holistic fashion, like looking at gut health, looking at making sure you're feeding your body the right stuff, making sure that you're exercising, making sure you're checking your cortisol, making sure that your hormones are optimized. Those play a role. So I would say GLP-1 agonist by itself does not guarantee weight loss. Mm-hmm. And I can't even say that our program with GLP-1 agonists will guarantee weight loss, but I can say that it is as close to a guarantee as you can get without me making a medical guarantee if you do our program.
And if you're ready to make the changes.
That's right. Yeah. And we talked about that. You got to be a co-pilot, right?
Yes.
And so, okay. I'm going to ask some of these other questions that we have here online. What is the best diet?
Okay.
Very open-ended question.
Yeah, it is. So the best diet really depends on the person, right? The goals, the lifestyle, and what you enjoy eating, and what you can sustain over time. But that said, there's a huge body of scientific evidence supporting a whole foods plant-based diet. So, and that is the same as saying that you have to eat more fiber through fruits, vegetables, legumes, nuts, and seeds. And the key for me here is legumes.
I agree.
Yeah.
So I think, my comment here would be it's probably easier to say what is not the right diet. I could tell you what's not the best diet. Mm-hmm. Potato chips, processed food, salami sticks, cookies. That's probably not the best food.
Yeah.
Or a whole meat diet or all meat diet, probably not the best. But to say the best is hard. It's not a one.
Yeah.
Okay. Is it good to intermittent fast?
Okay, this one, it really depends on the person as well. So we have to take an individualized approach. It can be really good when it comes to accelerate our metabolism. It can also reset our hormones, so it can be really beneficial for weight loss, but it's not suitable for everyone. There are some contraindications. So people with eating disorders or people who are pregnant or breastfeeding. So we have to take all of this into consideration before prescribing intermittent fasting.
Great. And some of these other questions I think we've answered. How does sleep affect the weight? We've answered that.
Or the menopause.
Belly fat that they can't lose. The diet is good. And postmenopausal, we've sort of touched on that. Lots of changes. If you may be past the sort of menopause prevention already. So we can holistic approach. Thoughts on Ozempic and ideal protein weight loss. Ideal protein, I think we sort of touched on this as well. Again, these other fad diets or diet programs, I just don't think they really do take a holistic approach.
Yeah.
It's easier to market and sell, right? But I don't think personally that it represents the best kind of treatment.
I think the same.
Best exercise for weight loss. I think you sort of touched on that, right?
Yeah, we usually the mix between the three.
Okay. Optimal numbers for hormones on HRT postmenopause. I don't think that that's something that we can answer here. It's not optimal. Everything's personalized,
Yes.
right? Weight loss strategies in menopause. We've talked about how do you lose weight during menopause phase. Again, it's about prevention, bioidentical hormones, and then again all of this stuff, right? Gut microbiome, all that stuff. Target belly fat. Now, I'd like to know your opinion, Connie, on, most people have this idea of where they want fat loss, right? Like, I just want my belly loss. The rest of my body looks okay. Or it's just my legs. I just want those gone. What are your thoughts on targeted body part weight loss?
I think it's really difficult to do, and we actually have to take a holistic approach as well. So if we want to lose fat, we have to worry about our visceral fat, and we cannot see the visceral fat. So as long as we address visceral fat, we will be addressing our subcutaneous fat, which is the fat that we see under the skin, right? And it's really hard to approach like specific part of your body, but we can address all fat. And maybe with some focused exercise, we can do more. But I think we have to rely on diminish every type of fat, like in a holistic way.
And I agree with that. And I just remember this. I may be dating myself. I just remember these TV ads of these machines that you could wear, like these bands that go around your abdomen and sort of jiggles your body. And then it's like, oh, this is going to make you lose belly fat. Let me tell you, it doesn't work. It doesn't take the belly fat away. But what can take your belly fat away is when you lose fat throughout your body.
Yes.
And so I don't know if this is necessarily true, but I've been told that you usually lose fat in the opposite way in terms of where you gain it. So if you put the fat last in your I think it's like if you put the fat last in your abdomen, that's the last part that it comes off when you lose weight as well. And so essentially you should be losing fat in a more generalized way.
Yes.
You can't do targeted. Okay.
Yes.
What food to eat, what exercises to do to maintain? I don't think I think you answered that. It's very personal.
Yeah.
How do you keep the weight off and not feel deprived? Now, maybe you can touch on that.
Yeah, so I think I briefly mentioned this before as well, but we have to, and you have to find, and both of us have to find the best approach for you. It has to be something that you are comfortable with so you can sustain over time. And we don't focus on like a huge calorie restriction, just a mild calorie deficit will do, which we most of the time achieve with a whole foods plant-based diet.
Okay. And just to clarify, a caloric deficit is not the same as a caloric restriction, right?
Yes.
So what do you refer to as a caloric deficit?
So we need like a minimum amount of calories to function, right? And it's, let's say it's 2,000 calories. So a mild calorie deficit means that you will be having less than those required calories for you to function. So around, it can be between 1,500, 1,800, depending on your activity levels, depending on your weight, on your height, and your age.
Could you not adjust that though? That number, that absolute number, could you not adjust it by increasing your basal metabolic rate? Because if you know, for instance, if someone's minimal caloric requirement is 2,000, that's based on an assumption of their physical activity. Like,
Yes.
for instance,
Yes.
a pro athlete, like let's just take a pro football player,
Oh, yeah.
their
that's-
minimum caloric
Can be
intake is
until-
probably like 4,000,
Yes.
right?
Yes.
And so that number isn't the same for everybody.
No, it's not the same.
Right? And so if somebody, for instance, is sitting around all day because they have a desk job and they don't do any physical activity, their minimum caloric intake may only be 1,800,
Yes.
for instance, right? And
Yes.
so part of, isn't it true, like part of what we can do is we can adjust that basal metabolic rate so that their minimum caloric intake to create a caloric deficit is higher,
Oh, yeah.
right? So so again, the short answer is it's very personalized. Okay. And so to our viewers, if you want to log on now, you can. There's a whole bunch of questions here that I'm just going to go through that will probably split up on the podcast. And so we're just going to answer them because I think this isn't, the people who registered, they took the time to ask these questions, so we'll just go through them as quickly as we can. But for those who want to log out, please do. Here's the number. If there's any questions, reach out to us at the phone number provided on your screen or the email. Go visit our website. Don't forget to text us if you want to win a gift card. And so thank you for everyone who's going to log out now, and we'll just continue with the questions here. Okay, so another question. Where is this? So we talked about this. What is the average? Oh, this one. How long does it take to achieve your weight loss goal?
Okay. Also really personalized, right? Depends on your lifestyle, your starting point, your goals, your medical conditions. But on average, like a good way to lose weight, it's around 1 to 2 pounds per week at the most. So you can achieve between 20 to 30 pounds in a 6-month period.
Yeah, I would say that that's about right. If someone told me that they wanted to lose 80 pounds, I've had people lose 80 and 90 pounds. It usually occurred within a year. Certainly there are risks to more rapid weight loss,
Yes.
right? Think bariatric surgery. They can lose 20 or 30 pounds in 1 month.
Yes.
But they have huge nutritional
Consequences.
problems. And so probably not the best way. But yeah, I think on average, that's a pretty good estimation. What is the average weight loss on your program? I think that's a sort of similar question. Expect to lose 20, 30 pounds in 6 months?
Yes.
Yeah, I think that's quite reasonable. But also, I would have to say a big variable is patience or
Commitment.
yeah, or person commitment. I mean, I guess person or patient, whatever you are a patient. We are a medical clinic, and so patient commitment, right? If someone's not committed,
You won't be seeing
yeah.
as many results as you want.
that's right. So I mean, don't expect to sit around on your sofa for 6 months and lose 30 pounds.
Exactly.
Okay. What is okay? Does wine cause cellulite? Interesting.
Interesting.
Do you have any
question.
thoughts?
Well, I'd say that cellulite is an inflammation of the subcutaneous tissue, and alcohol is a toxin, so it may potentially be a contributor.
Yeah, I think that's a nice, safe way of putting it. I mean, I think it could be a contributor. Is it like a direct cause? I don't think so. But certainly, I could tell you that alcohol generally is very calorie dense, and
Oh,
it's
yeah.
not the good calories that you use.
Empty calories.
Yeah.
That's
It's
correct.
often called empty calories, right? And so there are more and more studies out there that have actually come out the last few years that have shown that actually there's zero amount of alcohol that is
Safe.
healthy,
Yes.
right? I know there were some studies years ago that said, 1 glass of red wine for women or 2 glasses for men has some cardiovascular protective benefits mostly through the route of resveratrol, which you could honestly just get with
From
grapes. And so I usually tell patients, listen, you want to follow that study, go eat some grapes. Just don't drink the wine. Right? It's not really a usually popular recommendation, but it is based on science. Okay, weight loss for vegetarians. Interesting.
Okay, so for vegetarians looking to lose weight and for any dietary pattern, I'd say the key is focusing on whole, nutrient-dense foods, right? A lot of fiber, a good balance between fat and carbohydrates, right? And the good news, and I think one of the things that the person was asking here, if you can get enough protein being a vegetarian, right? But you can. It's actually pretty easy. We have a lot of options. So we have tofu, tempeh, we have texture vegetable protein. So it's actually easy for vegetarians to achieve like a weight loss. You just have to not relying on processed food, any processed vegetarian or vegan food, and that's the key. And for any dietary preference, you don't have to rely on processed foods or highly packaged foods, right? It's just about a healthy balance between fiber, proteins, and carbs.
And I would probably, and I think you would agree, I'd probably add in gut health in there as well.
Oh yeah, absolutely.
Right? And so just because you're a vegetarian, it doesn't mean that you've got a healthy gut.
No, especially if you don't meet the 30 plants per week,
Yeah,
right?
yeah. Which I don't
Or
think-
legumes.
I don't know if anybody does, but certainly, if you're a vegetarian and you've got a lot of antibiotic use, or you've got a lot of stress, or you
Exactly.
sleep poorly, and so all of these contribute. And so I think again, in the simplistic view of what weight loss in the simplistic view of weight loss to some people, right? Not people, but companies, is that it's just your diet, right? But
Yeah.
actually, it's so much more. If you sleep poorly, which was a question that we addressed before, right? If you sleep poorly, or you're in menopause, or you got hormonal imbalance, it doesn't matter if you're a vegetarian,
Yes,
right?
absolutely.
You could still not lose weight. Okay. So confused about food, so many different options on nutrition.
Yeah.
Yes. I don't know that we can answer that question. I mean, I think that it's an individualized.
That's
And-
a fact, unfortunately.
Yeah, I think everyone's confused about food. Okay, so sorry, it's not a very good answer, but it is personalized. Doctor told me to lose pounds for a good knee. Absolutely. I think you touched on this before, right?
Yeah, we have higher incidence of knee arthritis and hip arthritis, so it's actually necessary.
And it makes a lot of sense. It's like, if you ever went to go for a hike, and you carried a 50-pound backpack, I mean, that's hard on your body. It's hard on your back. It's hard on your knees. So just imagine doing that all day, every day.
Yes.
Yep. Menopause weight loss, we said, can you eat too little food? Next question. Can you overcome set points in your body where your body sheds the weight instead of fighting you to gain the weight? Are there natural foods, herbs, or supplements that act like Ozempic and have little side effect? And I think, we talked about this already.
The natural
right?
approach. Yeah.
Yeah. Stress eating. Any comments on stress eating?
Just that it's really, really important to take our mental health into consideration. And that's one of the things. We focus on the neurobehavioral component of obesity. So behavior is really, really important, same as the neurological factors, right? So
Yeah, absolutely. I would agree. Lots of menopause weight loss here.
Yes.
And so I think we've answered that. Can you recommend any programs for a food addict? Yeah, I don't know if I necessarily want to answer that on a podcast, actually, because it's a very local thing. But do you have any general suggestions of someone who may feel like they're addicted to?
Okay, so like a general suggestion, I'd say like mindfulness program recommendations, like mindfulness programs, and we have a lot on the internet. They can help 100% with mindful eating practices. That's key.
The other thing, I think actually this may help from a medical standpoint. I suspect actually that the GLP-1 agonist would help.
For the addiction, yeah.
For food addiction, because it certainly helps with the cravings.
It does help the
right?
cravings.
And when you again, it's a side effect, but when you're nauseous and your stomach feels full all the time, you even if you're addicted, it'll help with that sensation that you want to eat.
Mm-hmm.
Okay, and gut health, what do you think? In food addiction?
Yeah, absolutely.
Right?
We have
Because
to be focusing on our microbiome.
right? Because I just think like a lot of the food addictions per se, it may be cravings for certain things that the mycobacteria in our gut is telling us to eat.
Yeah, and actually we have our mind-gut connection as well.
Yeah. So I mean, there are options. I think GLP-1 agonists. I think gut health has to play a role, and certainly mental health. Yeah, you're right. So suggestions for navigating and reducing weight gain due to medications. Ooh. Yeah. What are your thoughts on that?
Well, here, especially if there is an autoimmune component with the medication or the disease, the focus is the trying to find the root cause, right? And if there is an autoimmune component in this, we have to be mindful of lowering inflammation, which is actually one of the ways that can lead to obesity, to any other chronic illnesses, and weight gain. So focusing on having this hypoallergenic diet, making care of our microbiome, avoiding triggering foods like dairy or gluten sometimes, that's really important.
And I would say, again, from a physician standpoint, I mean, work with your physician to
Of
see if
course.
there are other alternatives to these drugs, right? And so, the most common drug that I can think of that causes huge amounts of weight gain, and everybody knows about it, is prednisone. And so is there a way for you not to be on prednisone? I mean, that's a question that you should be talking to your physician about because it has all sorts of other consequences. Okay, so let's see. Do you recommend a certain diet? No, I think it's very personal. I think we talked about Mediterranean diet. I mean, it's one of the really good ones. I
Yeah.
agree. But it should be personalized.
It should
right?
be.
Okay. Contrave. What are our thoughts on Contrave? Do you have any experience with this, or you want me to answer it?
No, I prefer you to answer it.
Okay.
Yeah.
Let's talk about Contrave. I looked at the studies for Contrave, and it's not that great. And it's pretty expensive. And so what I would say is it's probably not that effective. But in some patients, it may be worth trying, especially if you're intolerant of Ozempic or, Ozempic. Actually, if Ozempic's too expensive, you're not going to be able to afford Contrave either because that's even more expensive.
Okay.
Or just as expensive. So I would say I've had very little success with Contrave.
Okay.
Okay. And so what I would suggest is, if you're not tolerant of a GLP-1 agonist, there are other ways, for instance, in our program that we could help you with in terms of like, gut health and, maximizing your own GLP-1 production and following a proper, a diet that's more personalized for you and controlling your cortisol and balancing your hormones. That's what I would say is probably preferred. Safety on Mounjaro with Hashimoto's. I think as a physician, I'd probably just answer this generally. Although I realize that you're also a physician from Chile, but generally I would say, when you look at the contraindications for any of the GLP-1 agonists, it's actually only medullary thyroid cancer,
Yes.
right? And having thyroid dysfunction, whether it's overactive thyroid or underactive like Hashimoto's, it's not a contraindication. It doesn't matter. How does your DNA testing in your weight loss program work?
Okay, so this is a really good one because we actually use Nutrigen by Fagron genetic test, and it's a really easy to do test. It's just a quick cotton swab test that analyzes over 100 genetic variations related to weight control. It covers factors like metabolism, fat, glucose, carbs, food intake behavior where we can actually see if there is an imbalance or eating disorder as well, exercise effectiveness, vitamin and mineral needs, and we can also check for lactose and gluten intolerance. So it's actually a pretty cool test to do.
Perfect. The next question is similar to that.
Yeah.
Genetic tests, MTHFR, how much does genetic test cost? Is any of it provincially covered? I mean, generally, I would say I'll answer this. It checks, you just touched on what it checks in terms of the information it provides. Not provincially covered. It does not have, I don't think it checks for MTHFR, the
No.
methyl.
But it looks for vitamin B9
Okay.
deficiency.
Yeah, I mean, there are other tests. I mean, the MTHFR is only one test. I'm not
Yes.
sure, it's important, but
We can
it's
just give the
one thing.
activated
Yes.
vitamin and that's it.
Okay. Let's see. We're almost at the end. Healthy, fast, non-medicated weight loss.
I think we talk about this.
Yeah. I would again caution on this idea of fast.
Yes.
We can do lots of things fast. I mean, I could put you on a 500 calorie dietary restriction. You're gonna lose a lot of weight, right? If you've ever looked at anyone who's sick, I just had a patient tell me that he's been unable to eat for the last 6 weeks or the last 4 weeks, and he lost 70 pounds. That's not very good. That's because you're sick. And so again, I want to de-emphasize fast. I know our society is all about convenience and fast, about this gig economy. I want a ride share now. I want to pick me up right now. I want my grocery delivered to me now, right? But listen, I mean, it took you years probably for your body to get dysfunctional and get that weight. Don't expect to get it away in 30 days,
Exactly.
right? You would be very unwell if that happened. And so, yes, there are non-medicated ways to do it, but take away fast.
Yes.
Reasonable time, I would say. And I'm not just trying to say that to sell more packages. I'm saying that because it's real from a medical standpoint. How do you lose weight when no matter what you eat, you gain? And how do you lose weight when you don't like veggies? I think we've sort of talked about that except for the last part. What do you do if you don't like vegetables?
Well, we always have legumes, right?
Can
We
you
always
just
have
remind
fruits
everybody,
to eat
like
legumes.
me, who may not necessarily know the difference, what is a legume versus a vegetable?
Okay, legumes are chickpea, lentils, mung beans, kidney beans, any beans that you can imagine.
Those guys. Okay.
Yeah.
Okay.
So, but we also have fiber for like complex carbohydrates, right? Quinoa, brown rice, whole grain pasta.
Okay.
Yeah.
Perfect. And then the last question here, curious about bioidentical hormones and if they will help with weight loss. The answer is maybe. I'm not going to guarantee it. But yes, if you've got big dysfunctional, I've had patients who have significant hormonal imbalance, and just balancing their hormones, they lost 40 pounds. Okay. Am I going to say that happens to most people? No. But if the main reason that your weight loss occurred or weight gain occurred was because of significant hormonal imbalance, then yes, balancing your hormones will help.
Yeah.
But I would say what hormone balancing does help people achieve is the motivation, the energy, the drive to be able to carry out the weight loss plan. Right? And that's a big thing. Like if you're too tired because your cortisol is crashed, right? And you can't even exercise, right? Or you can't even get motivated to want to sign up for this program. So sign up for the hormone program first, then you get motivated, and then you go to the weight loss program.
Yeah.
Okay. I think that's it. I don't think there's any more live questions.
Yeah, I had one late one come in.
Okay. What?
Says, does being dehydrated slow your metabolic burn, and how much water do you recommend drinking per day?
Interesting question about water that I just personally learned about recently. So the question is, does dehydration affect your metabolic rate, and how much water is an optimal amount?
Okay, so it depends on each person, right? But we have like a general calculation about like roughly 30 milliliters per kilogram.
30 milliliters per kilo. So let's say, I know in medical we like to think of the average weight of a man at 70 kilos, but that's not real actually. I would say the most average kilo for a man in North America or Canada is probably 80 kilos. So you're talking 30 mils per kilo?
Yeah, so 2 liters per day, roughly.
2 liters per day. How many cups is that? Cup is 250, right?
It should be around 54 ounces.
Okay, so I think I'm just trying to remember my daughter's baking things, and I'm pretty sure it's a 250 cc.
Yeah.
250 mils is a
One
cup.
cup is 250.
So that's 8 cups.
8 cups.
Okay. 2.1 liters.
8
Or
cups.
sorry, I'm doing my math wrong. That's 80 kilos and 20. 20 you said?
30.
30. So 2.4 liters.
Oh, 2.4, yeah.
So 2.4,
But not
that's like, that's like 10, almost 10 cups.
10.
That's almost 10 cups a day. Okay. For an 80 kilo guy.
Mm-hmm.
Okay. There you go.
This doesn't apply for people who are obese. Otherwise, you will end up
Oh,
with
yeah.
a recommendation of 3 liters per day or
Good
4
one.
liters per
Good
day.
one. So ideal body weight.
Yes, ideal body
Okay.
weight.
So I would probably base it on 80 if you're the sort of average height of 5'10". 5'10", 5'11", let's go 2.4 liters. Okay. Yeah, 8 to 10 cups of water a day is general. I think is a good generalization, yeah?
Yeah.
Okay. And so does dehydration affect your basal metabolic rate?
I don't know about that.
Yeah.
I imagine it does.
Yeah, I don't know about that either, but I mean, I think dehydration from a medical term is like when you really are short of water, but I think most people refer to dehydration as like me, for instance, who barely drank any water today. You just more like you just feel a bit parched. The answer is no, probably not. This may be, you may see people on social media talking about like dehydrating themselves before a bodybuilding contest, where they have to really slim down and get cut. That's different. I think they're dehydrating to get rid of the extra water in their skin so that their muscles feel more defined, but it's not anything to do with basal metabolic rate or any metabolism.
Yeah, I don't think so.
Good. Oh man, we are really over time, but we're gonna split this up. So we're going to stop here because I already said goodbye to the live panels or the live audience. So thank you, everybody, and thank you, Connie.
Thank you, everyone.